yeah, someone who's addicted to, say, alcohol, yeah, if they're an alcoholic, if they stop taking alcohol straight away, that can force them into a seizure because their body can't handle the fact that they haven't got any alcohol in them. Okay? Next topic. Autoimmune. We don't really need to know that because we're not in a hospital setting. Alright? Are we, sister? No. Right, so metabolic, right? Hypoglycemia. Now, does anyone know what hypoglycemia is?
The high sugar levels.
No. Right? Hypo, O is low. Always remember that. Okay? O is low. So, if you have hypoglycemia, yeah, you have low blood sugars. Okay? That's the main difference in diabetes attacks, is that a hypo, which is a low blood sugar, will cause a seizure. A high blood sugar will not. Okay? Hypercalcemia, right? That's another thing. That's where you've got excess calcium in your body. Again, that's something that can, you know, play with your nerve system and, again, cause a seizure. Next slide. Idiopathic and neoplasm. Again, we're not brain surgeons here, so we're not going to talk about them. This one could be quite interesting, though. Stress. Yeah, stress is a major causer of seizures. Okay, mainly stress will cause a seizure in someone who has epilepsy. Okay, that's the most common trigger is stress, especially for someone's first, you know, for someone's first seizure, definitely through stress. Okay, so let's move on. This is the part where we get interactive a little bit. Right, so we use the acronym STACK. And you're looking a bit confused at this one.
I'm not confused.
Okay. Right, so we look at STACK when we're looking at dealing with seizures. Anyone wants to take a guess, right, at what S stands for? Now remember what we said at the beginning of the lesson about CPR. So if you think about that, an S should be very easy for you to figure out.
C.
Huh?
Is it C?
Is it
Safe.
So
Said safe.
Safe. Yep. Secure environment. So, if I had a seizure right now, yeah, you'd be looking to move anything that I could have myself with out of the way. Moving that TV out of the way. Moving that chair out of the way. Yeah? You can't move this out of the way, but one you can stand there and make sure I ain't going to hit it. Right? You've got to make sure that the person who might be shaking on the ground, yeah, but they're safe. Yeah? Next slide. This is an important one that gets overlooked so many times. It's absolutely ridiculous. Okay? Some people who know that they have epilepsy will have certain procedures that you have to use and take place in. You need to time the seizure for this to be effective. So if you witness the person dropping on the floor, time it. Take a look at your watch, take a look at your phone. Yeah? It's alright someone getting the phone out and timing it, yeah, and videoing it, but how long did the seizure last? Yeah? Because how long the seizure lasts can determine what has caused the seizure. Yeah? And also it determines whether or not you need to call an ambulance. Next slide. Airway management. This is important. Okay? While the person is in the seizure, you can't always maintain the airway. What you can do though is make sure that they don't swallow anything. Okay? Whatever you do, don't interfere with the head. Alright? Do not interfere with the head. Yeah? If they're bashing it against the ground, roll up a cloth, roll up a towel or something like that and put it under their head so they can't bash it against like a concrete floor. Okay? But whatever you do, and I have seen this done, right? I have seen people hold the person's head. yeah, while they're having a seizure. Don't do it. Okay? Why do you think it's not advisable to hold someone's head while they're on the ground shaking and having a seizure?
You could swallow the time.
No. Right? That is a reason that we have to check the airway. You can always swallow your tongue. Okay? But that's not why you don't hold someone's head.
Because you're moving your neck.
Yep. You're moving your neck. Alright? So if you held your head in one place and then moved your body quickly in another direction, what's going to happen? You're going to damage your neck. Okay? In some cases, you could even break your neck and paralyse yourself, if not even kill yourself. Okay? So, we said airway management. Make sure the airway remains open, so make sure they haven't swallowed their tongue. Yeah? But whatever you do, don't put anything in their mouth. Yeah? I've seen people where they think it's a good idea to put a stick in someone's mouth while they're having a seizure so they don't swallow their tongue. Okay? In theory, yeah, it's great. But you stick your fingers in someone's mouth, and if they're in a full tonic-clonic seizure, they can bite your fingers off. Alright? And that's not a joke. Yeah? A person who's having a seizure, all of their muscles are working at the same time. Yeah? So they can, in some cases, be up to 10 times stronger than they normally would be in the middle of a seizure. Yeah? So if you put your fingers in someone's mouth and their jaw clamped shut, what do you think is going to happen? You're going to lose your fingers. Alright? It's not pretty. So, final one. Call 999. Now, why do you think I've put this one at the bottom of the list? Any ideas? Go on.
Not everybody needs to go to hospital when they have a seizure.
Yay! Awesome. Right, yeah. Not everyone has to go, not everyone has to go, you know, not everyone has to go to hospital after a seizure. If they have epilepsy and they know they have epilepsy, right, they don't have to go to hospital. They might not have to go to hospital. They'll have their own way of dealing with it, which we'll move on to now. I've got to do that. Right. Post-ictal stage. Yeah, so this is what happens after the seizure. This is about after seizure care. Now, remember what we said, recovery position. Okay? After the patients come out of the seizure, place them in the recovery position. Okay, this is to make them feel more safe. Means you can maintain their airway, check on them, make sure there's no injuries. So you can do a primary and secondary survey to check there's no injuries, no broken bones, nothing like that. Okay? Now, reassure the patient. Yeah? Because when they come round, they ain't going to know what's happened. Yeah? So if they're waking, it's like when you wake up when you're asleep. Yeah? Do you know the first thing that goes on? As soon as you wake up on the morning, you go, right, first of all, I'm going to get out of bed and do this. You don't. You wake up and you think, right, what am I actually going to do? Yeah? It's exactly the same as when you come out of the seizure. You're going to have to give your time, you know, give yourself time to actually boot. So, patients are usually very tired after a seizure, absolutely shattered. Yeah, if you go to the gym for an hour, 2 hours, right, they've just done that in the space of 10, 15 minutes, right? So every muscle in their body is going to be absolutely screaming, right? They'll be absolutely shattered. And they're going to be confused because they might not remember what's happened. Okay, they might not, they don't know. Okay, what's happened? I was walking along and then I'm looking at the sky. A bit weird. Right? But be very careful when you're approaching someone, okay? Especially seizure patients, because some of them can be quite aggressive. Yeah? So if they come round, okay, have you all heard of something called the fight or flight response?
Yeah.
Yeah? Everyone knows what it is? Cool, right. Most people can get that fight or flight, Yeah? And if they wake up after a seizure and they see a random stranger just standing over them, they're going to lash out. Yeah? So you need to be careful of that. So when you do like talk to the patient, yeah, after a seizure, be close to them, but don't be too close to them. Alright? You want to be able to block anything if they try and swing for you or anything like that. So, do we have any questions on this? At all? Any questions? Any questions? Right, okay. I think that's the last one. Oh yes, my key points. Right. Stay calm. Right? When dealing with someone in a seizure, stay calm. Right? Secure the area, make sure there's nothing that will damage the area. Time the seizure as well, and reassure the person. That's really important that you reassure them. So, I mean, it is possible.